In end surgery, precise manipulation is critical, while interference from intraoperative bleeding and effusion often compromises surgical efficiency and safety. OBS-Dm manual controlled suction coagulator, tailor-made for end surgery, redefines the new experience of surgical operation. With its innovative dual-mode design, the control buttons enable precise activation and regulation of coagulation. The user-friendly air hole shaft design enables flexible suction control by simply sealing the air hole with a finger. Electrocoagulation and suction can be operated independently or simultaneously, which greatly shortens operation duration, reduces the complexity of intraoperative manipulation, and realizes efficient intraoperative control of coagulation and suction. Effectively reduce the interference of intraoperative bleeding, improve surgical safety and efficiency. The freely bendable cannula breaks through the operational limitations of traditional cannulas. It can flexibly adjust its angle and shape according to different surgical target sites, and easily reach hidden lesion areas such as the nasal cavity and laryngopharynx. It causes no damage to surrounding normal tissues, improves the flexibility and accuracy of surgical manipulation. OBS-Dm manual controlled suction coagulator empowers end surgery with detail-oriented design, optimizing surgical workflow, improving operation efficiency, and ensuring surgical safety. OBS-Dm manual controlled suction coagulator, the premium choice for end surgery,